What do you feed your dog on a typical day? How many meals? What types of food? Commercial kibble, homemade, table scraps, treats? Do you give any human foods, leftovers, snacks, to your dog? If yes, what kinds and how often? What treats do you give and how many per day or per week? Does your dog get fatty meats, skin, bones, or processed meats, ham, sausage, deli meats? Do you feed raw meat, raw eggs, or raw food? Do you add dairy, milk, cheese, yogurt, or human dairy-based products? Does your dog have access to snacks or human foods outside scheduled meals, begging at table, scraps, garbage, leftover sharing? Do you monitor your dog's weight regularly, scale, or body condition? Does your dog receive supplements, fish oil, joint supplements, vitamins, etc.? Which ones and how often? Okay, let's start with how often do you change your dog's food brand or type or diet? Frequently, occasionally, rarely. Based on U.S. veterinary nutrition guidance and toxicity lists, these foods or practices should be avoided because they may harm your dog. Chocolate, coffee, caffeine. Contains methylxanthines, can cause vomiting, diarrhea, tremors, seizures, irregular heart rhythm, possibly death. Grapes, raisins. Can trigger acute kidney failure, even in small amounts. Onions, garlic, chives, leeks, allium family. Toxic to red blood cells, leading to risk of hemolytic anemia, weakness, pale gums, collapse. Macadamia nuts, toxic, may cause weakness, tremors, vomiting, hyperthermia, neurologic signs. High fat content risks pancreatitis. Fatty cuts of meat, skin, processed meats, ham, sausage, deli meats. High fat, risk of obesity, pancreatitis, digestive upset. Processed meats also have high salt and preservatives. Cooked bones, brittle can splinter, choking, mouth injury, intestinal perforation, blockage. Raw or undercooked meat or eggs. Risk of bacteria, Salmonella, E. coli, food poisoning risks. Raw yeast dough. Dough can expand in the stomach, bloating, possible gastric torsion. Yeast fermentation can produce alcohol or toxins. Too many calories, overfeeding or frequent table scraps. Causes overweight or obesity, increases risk of joint disease, arthritis, pancreatitis, reduced lifespan. General Veterinary Consensus Nutrition Guidance. Now we discuss what to feed, healthy dog diet guidelines. Based on U.S. veterinary nutrition standards and pet safety guidelines, choose commercial dog food marked as complete and balanced. This ensures essential nutrients without harmful excesses or missing vitamins and minerals. For puppies, especially large breed, use large breed puppy formulas to control growth rate and reduce orthopedic stress. For adult and senior dogs, consider foods with omega-3 fatty acids and joint support nutrients if joints are a concern. Feed lean meats, chicken, turkey, cooked fish, fully cooked, bones removed, cooked eggs, plain vegetables like green beans, carrots, cooked sweet potato, certain fruits like apple slices without seeds, blueberries, but treat only in moderation, as less than 10% of daily caloric intake. Always cook proteins thoroughly, no raw meat or eggs, to eliminate bacterial risk. Provide fresh and clean water at all times. Avoid giving large amounts of milk. Many dogs are lactose intolerant or dairy can upset digestion. Feeding schedule and routine. Feed at fixed times, for example, 2 meals per day for adult dogs, morning and evening. Avoid free feeding, food left all day. Measure food portions with a measuring cup or kitchen scale. Adjust portions based on body condition and activity level. Less active dogs need fewer calories. Use treats sparingly, as above, and preferably use a portion of their regular kibble for training, to avoid calorie overload. Monitor body condition. Supplements and when they make sense. Supplements can help, but only under vet guidance. Omega-3 fatty acids, fish oil, support joint health and reduce inflammation, good for older dogs or joint-prone. Joint support supplements, glucosamine, chondroitin, sometimes green-lipped mussel, but always check with vet. For digestive support, plain probiotic yogurt, if dog tolerates dairy, may be sometimes used, but ensure low fat, no sugar or additives. Avoid human supplement overdosing. Dosage must be vet approved. Food safety and testing, home and lab checks. To ensure dog food safety, especially if you prepare homemade diets, avoid raw meat or raw eggs. These may carry bacteria, Salmonella, E. coli. Store food properly. Dry food in airtight containers, wet food refrigerated. Discard expired food. If using home-cooked diet, periodically check with vet for nutritional adequacy, blood work, weight check, body condition. If sudden illness occurs after unknown ingestion, vet may recommend blood tests, fecal exam, or toxicity panels, depending on signs: vomiting, diarrhea, lethargy, tremors, weakness, panting, abnormal behavior, ingestion of choking hazards. What happens if dog eats bad food? Home and clinical treatment. If you suspect your dog ingested toxic food, chocolate, grapes, macadamia nuts, onions or garlic, cooked bones, etc., these are general steps, but always call your vet first. Call your vet or poison control hotline immediately. Do not wait for symptoms. Early intervention can save lives. Monitor symptoms: vomiting, diarrhea, lethargy, tremors, weakness, panting, abnormal behavior, ingestion of choking hazards. At home, do not attempt home medication. Remove access to harmful food items. Provide clean water. Keep dog calm. At the clinic, vet may induce emesis, vomiting if recent ingestion, give activated charcoal to limit absorption, provide IV fluids, supportive care, monitor vital signs. If bones cause choking or internal injury, may need X-ray, endoscopy, or surgery. Key take-home messages for owners. A balanced commercial diet remains the safest, most reliable foundation of your dog's nutrition. Treats and human foods should be occasional and well chosen. Many common foods are toxic or unhealthy for dogs. Portion control and regular feeding schedule plus monitoring body condition are essential to avoid obesity and joint problems. Supplements may help, but only under veterinary supervision. If you choose homemade diets, treat as serious. Consult vet for balanced recipes, store food safely, and monitor dog's health regularly. Always act quickly if toxic ingestion. Early vet intervention saves pets. Okay, thanks for watching. If you have any problem about your pet, please comment in comment box. Like and subscribe the video.